the new focus will be, well, is supposedly moving away from health and healthcare and formal healthcare services, much more to a health and well-being philosophy, whereby people improve their health through improving their well-being, by feeling better about themselves, by looking after themselves better, doing the fitness and the kind of diet, and learning how to manage their own illnesses, having access to resources which teach them what to do, and really trying to push wellness as a concept forward so that people don't actually run into health problems so much. Or if they do start to, they learn how to manage it. It's about putting health as kind of almost part of everything we do, so that our daily lives are really structured around a much healthier way of living. And I think it's also quite important for people to be able to access what they need as part of their normal day, rather than to have to step outside work or step outside going shopping or doing the chores or even playing football. They can access what they need. So, maybe there is more access to nurses, health advice, health advisors, blood pressure monitors, you name it, any of a number of different kind of interventions or initiatives that are being pushed forward. But you can access them without having to make an appointment with your GP in 2 weeks' time for a 10-minute face-to-face consultation, which probably takes you out of work for 3 or 4 hours by the time you had in travel. Now, one of the things that I think it could help us significantly is some kind of integrated website or portal where we can pull in together all of the sort of health and social care issues, all the local authority and housing issues, all the social infrastructure, all the leisure time pursuits like football and arts clubs, dance clubs, local youth clubs, music, other aspects of health and fitness and walking, and local industry, local employers, the police, fire services, everybody who's contributing to the local social infrastructure. If they can all be connected into this website or this portal, then it gives us a lot more power. I work in Stourport. Stourport's a town of 20,000 population or thereabouts. There's 2 practices. If we integrated everything that goes on within Stourport using that portal, we could have a very, very effective self-sustaining system, I believe, which would give professionals access to a lot of information, what each other's doing, who's doing what, how you can tap into what's going on, how you can share resources and share the information and the knowledge that you have, but also for the local population, for patients. We refer to them as patients obviously in the health service, but the local individuals can use that portal to access all aspects of their life. We talk about wraparound care or wraparound support. That's suggesting somebody very vulnerable who needs a lot of help and input. It's very difficult for us all to be there and all kind of literally wrap this person in care. But if you use the portal specific to that patient or that person, that individual, to each put your bit in, and you can see what everybody else is doing, that is effectively wrapping care and support around the person. And even, you can even have, say, son might live in Grimsby or somewhere miles away, can use that portal to check whether mum's blood sugar is normal, whether her oxygen saturations are fine, whether she's taken the tablets, whether she's eaten, whether the house is warm. And you can kind of get some reassurance then that, things are okay. And when things aren't, you can call for help. Hopefully somebody else will be noticing it, but, you can then, I think, manage somebody else's healthcare almost, or make sure their healthcare is being managed quite remotely. Yeah, I mean, we had this, the MyLife portal that's being developed looks very exciting. I think it's been designed specifically so you can use your smartphone to access it, which is very important. I believe it's now the case that the majority of people access the internet using their smartphone rather than necessarily a PC or a laptop. And obviously the structure of the portal needs to be designed to make it easy to use on your smartphone, and this certainly is. It brings back together all those kind of services that somehow have moved away, all those aspects of our lives that we really need to be kind of pulling all in the same direction. I think it's a very powerful tool, and I think it's something that could lead the way forward for communities like Stourport or the White Forest, or even the whole of Worcestershire and other places around the country.